It's time for Medical Monday now. Dr. Gerald Eckardt with BayCare Clinic. He's here now to talk with us about Brain Injury Awareness Month. Well, tell me, are brain injuries really a big deal?
They are a big deal, and unfortunately they're quite frequent. So we see them quite frequently, and up to about 100 people every day throughout the United States are affected by it, which calculates into millions nationwide that are affected by brain injury. So this is a very big deal.
Now, when do brain injuries, when do they typically occur? How often do they occur?
They do occur frequently, and it depends. There's many different causes. Most commonly, we certainly see them during car accidents when there's blunt trauma. There can be penetrating trauma from falls. You can even get them from strokes or something that you wouldn't think about, like a drowning episode where there isn't enough oxygen to the brain that can cause brain damage that way. So there's a variety of different things that can cause brain injury, and kind of varies on how it happens.
Wow, okay. So, well, what are some of the things you look for then? How would you know if you had a brain injury?
Right, so the symptoms of brain injury really depend upon the severity of the brain injury, whether or not it's a small bonk to the head like a concussion where we don't see anything on imaging. That can present with just headaches or maybe some dizziness, maybe some vision changes, where the more serious brain injuries can have nausea, vomiting, loss of consciousness, and unfortunately up to including death if we're not treated quickly.
So when you talk about treatment then, what does that entail? Is that different?
Once again, it varies. It significantly varies on what type of injury it is, but it's definitely a multidisciplinary approach, and by that I mean there are many, many people involved. The emergency medical technicians initially in the field, to the nurses and physicians in the ER, the intensive care doctors, neurosurgeons like myself, neurologists, and then most importantly rehab doctors, therapy, physical therapy, occupational therapy, because recovery from brain injury takes months.
Wow.
And this is something that travels from the field with ER to the hospital and then afterwards to a rehab facility.
So then the promoting question here is how do you prevent this? How do you make sure this doesn't happen to you?
Sure. So brain injury can happen to all ages. So I like to kind of talk about that by age groups. So for the very young, making sure that when you're in that car, every baby is secured in a properly fitted car seat. When your young kids are out running around, playing sports, riding bikes, snowmobiling, ATV, make sure they have a helmet on, make sure they have their seatbelt on at all points in time. For people like you and I, buckle our seatbelts when we're out driving. Make sure that we're not, heading home from the bar and drinking when we're driving. For the elderly, making sure that there's no trip hazards in their house, the house is well lit, and anything that we can do to prevent falls, anything that we can do to prevent these injuries from happening, we need to work on that.
All great advice. Thank you, Dr. Eckardt. And for more information about brain injury awareness, visit our website and click on this story. We'll be right back.